good morning, good afternoon, good evening po everyone. Saan man panig po ng mundo kayo naroon. Welcome to our 133rd episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And to all those who have discovered us for today for the very first time, welcome po. At sana po marami po kayong matutunan sa ating topic for today. Maitanong ko nga po, have you received a COVID-19 booster? As the virus continues to mutate, boosters are increasingly important in ensuring the populations are protected from outbreaks. Health workers in particular need to be protected through vaccination, and vaccines for the COVID-19 pandemic using mRNA promise easier formulation or tweaking to keep in pace with a rapidly mutating virus. In late last year, the US FDA authorized, as well as with the recommendation of the Centers for Disease Control and Prevention, 2 updated boosters. The boosters target 2 Omicron subvariants, BA.4 and BA.5. The new booster called Bivalent vaccine po, which means it contains 2 messenger RNA or mRNA components of the coronavirus, and half the vaccine targets the original strain, while the other half targets the BA.4, BA.5 Omicron subvariant lineages. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday, and always looking forward to Fridays because I get to share hosting duties with our adjunct research faculty, also internationally renowned public health communication expert, Dr. Susie Pineda Mercado. Dr. Susie? You're on mute, ma'am.
Hi, good afternoon.
Good
afternoon, Raymond, at magandang hapon po sa inyong lahat. All of you who are watching us, who are joining us in Zoom, and those of you who are watching us on Facebook, on YouTube, of TVUP and the University of the Philippines. And for those of you who are watching on the playback, welcome to the webinar. And it's great to be here, great to see all of you. We've got a great topic. And just for those who don't know yet, we are also on Signal TV channel 101. So we are on mainstream television as well. So today, the Department of Health will share the latest data on booster rates according to region and age. And an update will be provided on the inclusion of bivalent vaccines in the vaccination program, particularly for health workers. So handa nyo na yung mga questions nyo about bivalent vaccines. Raymond has explained already that what this means is that the bivalent vaccines can hit two variants. So we will hear from Dr. RAZEL from the DOH. And then we will have Dr. Annalisa Onglim, one of your favorites, who's so good talaga in public communication for medicine and health. So we're just so happy she was able to join us on short notice. She will give the point of view from the point of infectious disease. And another favorite of yours is here, Dr. Maria OFELIA OCANA-ALCANTARA, OFEL-ALCANTARA, former mayor of the Municipality of Tolosa, Leyet, and she will reflect on the role of LGUs in the booster campaign of the Department of Health. So stay with us. We've got lots of we've got great speakers, and then we've got closing remarks and synthesis by Dr. STELLA Marie Legaspi Jose, newly appointed head of the Expanded Education Training Office of the Philippine General Hospital. So, as you know, in our opening billboard, we have transitioned to using COVID as an acronym, COVID. And while we're doing that, we still continue to talk about COVID. So we're covering other outbreaks, infections, viruses, and disasters, but we are still, anchored on the discussions on COVID. And we want you to get the latest from the experts. So please stay with us. Now, I know that many of you are also interested in the latest news and, developments in medicine and public health. So it's for this reason that we bring you the news update.
Okay, for our very first news update, something that maybe people might have underestimated, but this news is entitled Student Mental Health Week focuses on rates of stress and anxiety. There's a recent study that showed that nearly 1/3 of students worldwide, hindi lang po sa Pilipinas, hindi lang po sa Estados Unidos, worldwide, have said that their mental health has worsened since returning to campus, since bumalik po sila sa campus following COVID-19 lockdown. So as mental health issues rise among the teens and college students, this is really a focus of the Global Student Mental Health Week, and it couldn't be better time, especially with suicide rates on the rise. This campaign is has been established by 5 youth-focused nonprofits to draw attention to this issue po. And all week, we hope that there is much more, let's say, social media, live events to help educate policymakers, educational institutions, communities on the mental health challenges that students are facing. What about you, Dr. Susie?
Thank you very much, Raymond. According to Reuters, the World Health Organization says that the risks to humans from H5N1 bird flu remains low, but we must prepare. The recent spread to mammals of H1N1 influenza, commonly known as bird flu, and has been observed in poultry and wild birds for more than 25 years, is now being reported as an infection in mink, otters, and sea lions. And so WHO is saying this needs to be monitored closely. People are advised not to touch dead or sick animals from the wild and to instead report them to local and national authorities who are monitoring the situation. So we have to watch out for this. WHO recommends strengthening surveillance in settings where animals and humans interact. And that's it for our news for today. We'll see you next week again on the news update. Okay, and we're back. We have a very interesting topic today. Raymond asked us if you've had boosters and what do we know about the effectiveness and efficacy of these bivalent vaccines, which are produced by Moderna and Pfizer. So we have asked some people, ordinary people on the street to comment, and Raymond's going to cue that. Raymond, go ahead.
Thank you so much, Dr. Susie. To set our discussion into context, hopefully everyone is able to see this short video produced by TVUP. And in this person on the street interview, we asked the question, have you received the COVID-19 boosters? Gaano po karami na ito? Bakit sa tingin po ninyo importante ito? Have you heard of the COVID-19 bivalent vaccines? At ano po sa tingin ninyo ang maaaring mangyari pag kinuha po ninyo ang bivalent vaccine boosters? Please watch this.
I have received an COVID-19 booster, second booster. So 2 times pa yun, second booster.
Yes, I take the COVID-19 booster and 3 times, which is first dose, second dose, and third dose.
Yes, I've received COVID-19 boosters. I've got it twice.
Hindi pa. Kasi natatakot ako dahil unang-una, marami akong naririnig about sa booster na hindi magandang epekto. At isa pa, siguro kaya ako natatakot dahil kulang din sa information about sa mga booster.
I think it is important nung nung unang kasagsagan ng COVID-19 kasi yun yung isa sa mga pass mo para makapunta ka sa mga iba-ibang establishments. Tapos even sa work, naging requirement yun para makabalik kami sa field office.
I think it's important kasi it refreshes the antibodies. So kumbaga, more boosters, more chances na malabanan mo yung COVID-19.
Nakakatulong to for us kasi di naman sila gagawa ng basta-basta na vaccine.
Actually, hindi ako familiar sa kanya. Ngayon ko lang siya narinig. Sa'yo ko lang siya narinig actually.
No, I've never heard of it.
Hindi ko alam kung anong meron sa bagong booster .
For me, it is the first time I heard that bivalent COVID vaccine.
Sa akin, okay lang naman another booster. as long as tried and tested. Yun nga, since hindi ko pa siya naririnig.
Dahil hindi ako familiar sa kanya, hindi ko nakikita yung importance ng magkaroon ng isa pa. Tapos dahil din siguro nakikita ko na yung antag dito, pagluwag ng restrictions and all, hindi na siya naging ganun ka-compelling na magkaroon ng bagong vaccine.
So, medyo iffy ako about it compared to the other boosters, but if it's proven naman na nalalabanan nga niya yung mga variants, then I'm G for it.
Siguro yung information, yung mas maraming dapat napaliwanag about dun sa booster, kung para saan siya o kung anong magiging sa tao, yun siguro yung kulang.
So I think basically just getting more people to be aware na there are still new variants coming and there are ways to combat it. Parang feeling ko just from that, and then it'll develop on its own na people will slowly get into the idea na, okay, there's this new variant, but there's a way to fight it. So let's get that new vaccine.
Okay, thank you very much. Thank you very much, TVUP. We always appreciate the person on the street. Raymond, ang galing, parang nagkakaroon tayo ng idea kung anong iniisip. I think there's some confusion about what a booster is, how many times one needs to get a shot.
Correct.
And it looks like most have not heard about the bivalent variant vaccine. So I think this is really great that our frontliners and our regular community here at Stop COVID Deaths has the latest information on that.
That's true, Dr. Susie. And I think it's really refreshing naman to note that even if we were able to ask some of the younger folks who should be in tune sa social media, lagi silang nakamasid dyan, even that, I think they still need more information about the bivalent vaccines.
Oo, mukhang ganun nga, parang they were all saying we need more information. So this is good. We're now going to give more information.
That's true.
And we hope that our audience will be part of the multiplier effect. Sige. So you have some housekeeping, Raymond?
Little bit of housekeeping for all those who are asking. Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. We have already sent out for 131 webinars, the certificates. For 132nd webinar number 132, we are still sending it out. So please keep an eye out in your emails po, no? So, but if you did not receive a certificate and you feel you should have, please email us at stopcoviddeaths@up.edu.ph. For our webinar for today, we will be having a standard panel discussion format. After our main speakers presented, we'll have 2 reactions po, no, from excellent reactors, followed by a Q&A session. But before we delve into the webinar, I know everyone is very excited about our fun quiz. So let's have our cute introduction video for our fun quiz segment.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Raymond, ilang beses ko na nakikita to, natatawa pa rin ako eh. Sige, year of the rabbit daw kasi. Okay, let's go to the fun quiz.
Okay, for our fun quiz for today, let me just pull it up. Okay, there we go. So for those who are joining us outside of the Zoom, please open up your browsers and type in slido.com, and when you are prompted, enter the code 6510096. That's 6510096 for you to be able to participate in our fun quiz. Today, we have 2 questions. These are as follows. Receiving. The primary series refers to receiving, ano po ba? Is it 2 doses plus 1 booster? Is it 2 doses only? Is it 3 doses plus the booster? Or is it 2 doses plus the bivalent booster? We'd like to greet those who are joining us from the Novaliches District Hospital in Caloocan City, from the Department of Health in Cagayan Valley in Region 2, from Western Visayas Medical Center in Mandurriao, Iloilo City, from Cebu Doctors University in Cebu, Rivera Medical Center Incorporated in Panabo City, Davao del Norte. You'll also see in the chat, there are those joining us from the Pediatrics Clinic OPD ng Philippine General Hospital, those who are joining us from Bataan, from Los Baños. Thank you so much sa ating mga sa ating mga masugid na tagapanood from New Sinai School and colleges, from Rizal Medical Center, what else? From the Schools Division of Isabela Regional Office of Tuguegarao. Maraming salamat kay Sir Joseph, who is our avid viewer. Okay, we have those coming in from other countries, pero mamaya po we'll greet them from Iloilo and Dumangas. Thank you so much. And marami pala tayong mga international for today. So we'll greet them later on. So we'll go ahead with question number 2. For question number 2, what is the appropriate time interval for receiving the booster? Is it A, 6 months after receiving the primary series if the 2 doses or of the same brand? B, at least 3 months after receiving the primary series? C, it is not needed if you have had previous COVID-19 infection? Or D, lahat po na nabanggit or all of the above? We'd like to greet those who are joining us. I'm seeing here those from New Jersey and from Taiwan. Thank you so much for joining us here. Edison, New Jersey po iyon. From Chonin Hospital in Taipei City, Taiwan. From Penang in Malaysia, Bangkok in Thailand, Saigon International College in Ho Chi Minh, Vietnam, Lunichi Alib University of Blida II in Algeria, University of Hail in Saudi Arabia, Stockton, California, Los Angeles, California, in Adelaide, Australia, and St. Eustatius Auxiliary Home Foundation from the Netherlands, Antilles po. We will not be closing ito pong this fun quiz po natin because we want everyone to be able to really understand very technical discussion for today, but hopefully it is something that you'll remember after this webinar as we move on to our main presentation and webinar proper. Dr. Susie?
Thank you very much, Raymond. I just wanted to greet those who are watching us from Ahil, the Kingdom of Saudi Arabia. Parang ang dami ngayon. No, we used to
ang
have
dami
Dr.
international,
Rico
Dr.
lang.
Susie.
Now we have a number who are watching, and we're just what should I say? We're just so happy that we're able to serve you, even if you're far away, as well as those who are watching from different parts of the world. No, we're here for you, and we hope we can continue to give you relevant updates. And I think this update is really very important. So we have we're very fortunate. We've got a resource person from the Department of Health. Okay. So she is new to our webinar, but she's the Director for Standards and Sectoral Strategy for the Disease Prevention and Control Bureau of the Department of Health. So I would like to warmly welcome, and let's welcome her, Dr. RAZEL NIKKA How. NIKKA, welcome to the webinar.
Hi, thank you. Thank you, Dr. Susie. Thank you, Raymond.
Sige, go ahead with your presentation, NIKKA.
Sure. So thank you, Ren, to everyone who is joining us today. I know this is a very hot topic, and I'm glad that there's a lot of interest to know about what we are currently doing in terms of our COVID-19 vaccination and kung ano rin yung directions natin moving forward. So I have prepared a couple of slides just to first go through with you ano na ba yung nagawa natin, no? And then also at the end discuss what the future plans will be. And I want to start sana with this slide. This slide is showing you our trends in terms of data, no? Data in terms of our cases, in terms of our hospitalizations, and in terms of our critical cases. And as you can see, throughout the course of the past years, no, we have seen that we are able to now have less cases, less critical admissions, less hospitalizations, and we are able to maintain this even if we are slowly and carefully opening the economy. And many of these gains are really possibly due to the protection that is being provided by our COVID-19 vaccination program. Lalo na everyone was really involved in all of the steps and in even the promotion of everything related to vaccination. So to date, we've already administered over 166 million doses. Majority of the population already have their primary series or the first 2 doses and have completed the dose. And more than a fourth of the population has already had their booster dose. And throughout the years, because of everyone's efforts, talagang lumaki, no, from a very slow adoption of the vaccination program to the current state that we already have now. And it was repeatedly assured to everyone that everything that the Philippines and the Department of Health is rolling out has went through all of the rigorous process of assessment from FDA in terms of regulation, no? So FDA kasi yung nag-assure sa atin that all of the drugs and medicines are safe and are effective. Even our expert groups, by putting this among clinical practice guidelines, verifying that there's clinical benefit to doing all of these interventions. And also even our Health Technology Assessment Council, no? They have advised that these are also very cost-effective priority health interventions. It is with all of these evidence-based direction setting that we are able to implement all of the things that we're doing for the vaccination program that all of us nga as a whole society rallied for, no, in the past couple of months. When we implemented the vaccination program, we started with very limited supply and we had created our prioritization framework, no, kung sino yung mga pinakakailangan talaga to have this level of protection. We started very first with our healthcare workers, or with what we call the priority groups A1, and our senior citizens. Now, they are the most at risk for having severe disease and death, and also those that are immunocompromised and with comorbidities. So we went through that phased process as with all other rollouts, no? Even when we started with adding boosters, adding second boosters, for example, it always follows this same phased implementation process. And to date, no, everyone, almost everyone is now eligible to have both the primary series and the boosters and the second boosters to it. Ngayon din po, no, para hindi na confusing, we're looking at and also communicating in terms of age groups, no. Definitely hiwalay pa rin talaga ang treatment at priority na binibigay natin sa healthcare workers. But clearly, older age groups are the ones that we are prioritizing to maintain the necessary level of protection brought about by the vaccines. So we also have a series of different brands, no, or different types of vaccines available in our program. The ones mentioned here, no, AstraZeneca, Gamaleya, Pfizer, Moderna, Sinopharm, Sinovac, Sputnik, and Janssen. And these different types were brought in to make sure, especially at the early stage, na we're already able to provide all of these necessary vaccines on the ground. So for those who have not yet had their full vaccination coverage, no, or kaya hindi pa nagbo-boosters, ito yung reminder, no, na you should have at least 2 doses of the original vaccines, or if you had the Janssen, at least 1 dose of that. And then after 3 months, you should already be having your first booster dose. No? If you got Janssen, you can get it as early as 2 months after your primary series. And there's any combination of an additional booster dose that you have an option of providing. And then, for these groups na posibleng magkaroon ng second dose, and that includes our healthcare workers, our senior citizens, and all of the adults na merong sakit, no, may comorbidities, they can actually have a second booster 4 months immediately after the first booster dose. So even for our children, we have also the same intervals, no? Meron na po tayong primary series for 5-year-old and above, and then booster vaccination for 12 years old above. At least 5 months from the primary series kung regular children po siya. But if these are children who have had additional conditions or they're immunocompromised, they can have it as early as 28 days after the completion of the primary series. Among our attempts also is to make sure that everyone will be covered, no? And we really made efforts with all of our other partners to make sure that we're able to maximize our access and that we expand the coverage of the implementation sites to places where people usually frequent. And that's why you can have these vaccines at very convenient places like offices, factories, malls, terminals, churches, markets, no, yung mga public places like plazas, even in schools, clinics, boutiques, no, and the hospital. And we continue to have this as among interventions to be done with the LGU. And dun sa palagi ring nagtatanong, no, these are also always available in our primary care facilities or in our rural health units, no. And these are continuously being provided up to now for those who have not yet had their booster vaccination. A lot of this was really because of the many great efforts of our local government units and how we with them have prioritized what are the areas that really need to have additional push to make sure that they have access to all of these vaccines with our vaccination please. A lot of the things that we are currently having now, no, itong opening of our economy is because of the protection that is being provided to us by vaccines. And the having high coverage, especially yung first primary series, no, has gotten us here. I show you here yung coverage natin right now in terms of the different priority groups. Especially for our healthcare workers, we're actually very above 95% in terms of the number of healthcare workers who have their necessary primary series. Medyo mababa pa rin po tayo sa other adults and then sa senior citizens, only at around 80%. But that's generally acceptable coverage already in terms of the primary series. What we are currently grappling now, no, is with the slow uptake of our booster vaccination. So even among our healthcare workers or yung ating priority group A1, only 63% of our healthcare workers has had their first booster coverage. And only 30% of them has had a second booster, no? More so yung ating ibang priority groups like our senior citizens na 30% pa lang sa kanila ang boosted or 10% for second booster. And our adults with comorbidities na nasa 30% pa lang din. So there's really a lot of things that we have to do more, especially in terms of encouraging people to have their first or their second booster. And this is also something na hindi unique to a certain place. If anything, it is us in the National Capital Region who has the highest among the other regions in terms of primary and booster coverage. But we do want that every area in the country, especially across our priority groups, will have this adequate protection, not just from the primary series, but also from that additional dose for boosters. Bakit? No? Ang goal kasi natin is that, especially with opening of the economy or this endemic state, no, kung saan tinatanggal na yung mga dating mga restrictions ng mask, ng mga activities na hindi pwede dati, fully reopening school and travel, we have to be here protected, no, with our layers of protection, and definitely vaccines give us that additional layer of protection. And it has been the target of national government that we have to reach 90% primary series for A1 and A2, yung ating healthcare workers at senior citizens, and at least a 50% coverage for the first booster for every one of our adults. No, that's still and remains to be what we are pushing for against. And as you see, we still have a bit of a way to go to meet all of these different targets. The reason that we're also pushing for booster vaccination specifically is because it is well established. No? Alam nating lahat that vaccine efficacy wanes over time. Ibig sabihin, lumiliit yung protection na binibigay ng bakuna over time. Even our global experts agree. So this was among the slides presented when we as the DOH participated in these global discussions, no, na it's very clear that the primary series or the 2 doses is not enough. A lot of protection is provided by the first dose. It will dramatically decline your capacity to have infection or symptomatic disease. Ibig sabihin, pag yung pagkakaroon ng sakit, no, pagkakaroon ng sintomas, naapektuhan siya. And although it's a minimal protection against severe disease and death. So yun yung two pictures that I'm showing in the left side of the screen. No? In terms of severe disease and hospitalization, the primary series will still have some protection. But in terms of being sick again, having it, transmitting it, there is a significant decline. No? And similarly, yung second booster dose is also ganon yung ipinag-aaralan pa. No? It's currently ongoing discussions on quantifying gaano kalaki yung impact niya, especially to the high-risk populations. And there are also ongoing global studies and more data is needed to establish that. But what is clear is 2 is not enough. At least 3 is necessary. No? And that's why everyone globally has been pushing for a booster vaccination for everyone who has had the primary series. And even us as a DOH continues to promote, no, and strongly push for this message na hindi sapat yung dalawa. No? 2 doses are not enough, both for the eligible children, yung 12 years old above, and all of our adults, especially yung ating mga older adults. And the DOH has also been trying to figure out bakit ba mababa, no, yung ating uptake ng booster vaccination. And some of the barriers and enablers that have been discussed, I will also show some of them in the next slides. No? So a lot of the actions of the DOH, for reference lang of the audience, have been developed because of feedback that we have been receiving. No? So yung mga issues of access were the reason why we expanded to other areas, yung mga issues about wrong perceptions about the vaccines, kaya maraming mga media forum and activities like this wherein we try to explain, no, the values of some of these interventions. But something that's very striking is that it seems that there's also a factor of people waiting for new vaccines to be developed and to be created, or before they have their booster vaccination. No? So in this study, for example, we showed that there were actually people who will be interested to receive their booster if they get an additional vaccine, such as the Bivalent. No? Although there will still be a certain population percentage that still have doubts up to this time of our vaccination program. And it was also shown here that they think that there is an additional protection to be brought about by the bivalent vaccines as opposed to the other vaccines that we currently have now. Some other additional key insights from the survey is that yung mga usual na bakuna are those that are employed or that are have higher educational status, and then it's usually those with lower income levels, lower education levels, or not employed who have more instances of vaccine hesitancy or refusals. A lot of the reasons for refusal continue to be some concerns about possible side effects of the vaccination, and some misconceptions about vaccine effectiveness. So we actually heard some of them in the clip that was showed earlier, no, na parang feeling that the primary series is enough or that an additional booster is not necessary. So those are among the messages that continue to circulate, no, kung bakit hindi nagpapa-booster at nagpapabakuna pa yung iba. And it also was highlighted here that if messages are encouraged by experts, by trusted workers, and that is what we are as healthcare workers, it actually leads towards more positive feelings about the vaccination and that they're more encouraged to go into the vaccination program. And definitely the DOH is taking note that this perception of having the bivalent vaccines is also something people are looking forward to and waiting for before they get their additional booster vaccination. But I wanted to show the next few slides to clarify also on this. So we see that the global community has been moving towards bivalent vaccination, especially when the US CDC and their advisory group changed their recommendation from the old vaccine to this bivalent vaccine, which has the newer strain, and also when the European Medicines Agency started authorizing the use of the bivalent vaccine. But what I want to highlight also is the strong position of WHO and also of our current assessment of current evidence na our original vaccines actually maintain a relatively high vaccine effectiveness. And although recent reports can already state that they can broaden and enhance the immune system, itong mga bagong bakuna na ito, hindi pa enough yung ebidensya at this point, no, to support any preferential recommendation for the use of bivalent vaccines over the prior vaccines. And the message is very clear that everyone needs to be boosted and that any of our vaccines, whether the old monovalent ones or these new bivalent vaccines, will be able to protect you, especially against severe disease and death. But rest assured, no, we at the DOH are always on the lookout of these new developments. We're actually already tracking global developed teams. A lot of the old monovalent vaccines are already now under standard authorization or regulatory approvals ng mga FDA nila. And our current FDA is also now actively transitioning some of the old vaccines from an emergency authorization to a regular product authorization. Na ang ibig sabihin po kasi nun, pag nasa regular route na, it can also now be available in private markets, no, or yung in our retail establishment. So that is really something that's upcoming, especially with a very clear directive from the Office of the President that we are now shifting towards new normal, no, or going back to the standard protocols of how things are being done. Similarly, no, itong mga bivalent vaccine din are also actually now being granted full authorization, although konti pa lang, no, nagsisimula pa lang sa European Union. But usually what happens is if one country already allows it, no, nagsusunod-sunod na kasi the suppliers now broaden the reach to the different regulatory agencies in different countries. And in a matter of like a year or so, it will also be available in other settings. So with this, just also be aware that in the upcoming months, no, weeks or months, the DOH will be also starting an initial rollout of bivalent vaccines. First coming from donations, no? So the COVAX, dun sa mga hindi po nakakaalam, ang COVAX po kasi is a global collaborative ng iba't ibang international organizations and ng iba't ibang countries na nag-share ng mga different supplies, no, to all other countries. And we are set to receive a few initial doses for the bivalent vaccines. And similarly, katulad nung ginagawa before, no, when these new interventions come in, it's used in a phased implementation and nagsisimula doon po sa ating mga priority groups, no. And palagi po nating priority group ang healthcare workers at ang ating mga senior citizens before it is eventually rolled out to other population groups. In terms of direction din po, as the Department of Health, we are also including these now in future plans of our life state program. So, if you're familiar, meron din po kasi tayong ibang mga immunization program sa bata, sa buntis, sa matanda. And masasama na rin po, no, in the future yung rollout nitong mga vaccines na ito in the usual immunizations of all of us as we progress through our life stage. So, I'll end with this slide. No, I know papyaw lang yung ginawa natin today, but I hope I was able to explain where we're at and where we're headed in terms of our vaccination program. And just our few calls, no, or our asks to our fellow healthcare workers is, of course, first, marami tayong kailangang systems and structure-related changes to maintain what have been protecting us for infectious disease, no? Infection prevention and control measures, ventilation, sanitation. So we have to have our long-term plans to make sure that all of these are part already of our development planning and investment planning. But even so, we also have to ensure that the value of vaccination is top of mind to everyone. And if there are still those that are not yet, please encourage po sana, no, na we remain up to date with our vaccination. And for our healthcare workers and seniors, even it's up to even having second boosters. And this is something to reassess for yourself, for your families, for the people around you, and of course, the people who are going to you for consults are seeking your expert advice. It's also very clear, no, na especially at this point, both the original and the bivalent vaccines work, especially against severe disease and death. And we will be needing your support, of course, in all of these rollouts. And if ever you do want to get more information, the DOH is always willing to help and explain a lot of our directions. And you can always get all of this information in our official DOH channels. So thank you very much po for the opportunity. Maraming salamat po.
Okay, thank you very much. That's RAZEL, NIKKA. Thank you for that great presentation. I thought it was really very comprehensive, and you'll see the appreciation of our audience in the chat box. And we're grateful that you'll be able to stay for some questions, because there are already questions coming up both in the chat box and in the Q&A. So maraming salamat. Raymond, over to you.
Thank you, Director NIKKA and Dr. Susie. Thank you so much. Next up, just so we might have some time for the Q&A, it's my pleasure to introduce to you our first of two reactors. She's excellent communicator, pediatric infectious disease specialist, and also a member of the DOH Technical Advisory Group. Suking-suki na po natin siya. Please welcome again to the webinar, Dr. Annalisa Onglim.
Thank you, Raymond, and thank you once again to the TVUP team for this invitation to join you and have a chance to talk about this very interesting topic. I really appreciate the interview, no, with the person on the street, kasi nakikita talaga natin kung ano ang nasa isip ng mga tao. And I think I was quite concerned about the fact na marami pa ang nagdadalawang isip tungkol doon sa pagtanggap ng booster, let alone talking about the bivalents. So although ang ating topic ngayon ay tungkol sana sa bivalents, I hope you'll allow me, no, to speak a little bit more about the boosters. Then saka natin puntahan yung usapin ng bivalent para mas maintindihan natin kung ano ba ang dahilan kung bakit kasama ang booster sa programa. So if I can just share my screen. Yan. So ang aking gustong saguting tanong is, are boosters needed? So, papakita ko lang tong ating data sa ngayon, no? This is actually from mid last month. And makikita naman natin yung pattern ng dami ng kaso natin sa Pilipinas. Galing dun sa kasagsagan ng napakaraming kaso nung start ng January last year dahil pumasok na si Omicron. Awa ng Diyos, bumaba ng gusto yung mga kaso. At although ngayon, relatively lower na siya kumpara doon sa ating peak nung January 2022, marami pa rin tayong kasong natutuklasan at we have to understand that this is just the peak of the iceberg kasi alam din natin na marami ang hindi na nagpapatest, no? Ina-assume na lang ng karamihan sa atin na pagka tayo ay may naging kasama sa bahay or sa trabaho na nagkaroon ng COVID, ay COVID na rin ang sakit natin at marunong na tayo mag-ingat para hindi pa natin maipasa yung ating sakit. Ngayon, we are very fortunate that we have the capacity to be able to identify the different circulating variants na kumakalat sa Pilipinas at makikita natin dito galing sa ating Philippine Genome Center na lahat ng samples na dumadaan sa whole genome sequencing ay Omicron. No, so ito na yung pinakalaganap na variant of concern na nakikita rin sa iba't ibang bansa sa mundo. And kung sumusunod po kayo sa balita tungkol doon sa iba't ibang Omicron sa variants, ito pong medyo mas kilala na XBB and XBC, no, na siyang parating nababalita sa mga bansa in the West, ay maliit lang ang porsyento na represented in our samples. They're under 2%. Mas marami pa rin yung tinatawag na BA.5 na isa dun sa mga unang klase ng Omicron sa variants. So, ano na nga ba si Omicron? Actually, kung iisipin natin, no, napakalayo na niya dun sa pinakanunong wild type na COVID virus. Although in this diagram, parang lilima lang sila na nandito sa table na iba't ibang variants of concern. Actually, meron pang ibang natuklasan na hindi na masyadong kumalat, kaya hindi na sila gaanong nabigyan ng pansin. Etong kumakalat na Omicron has been detected since November of 2021. So kung iisipin natin, naka 1 year, higit 1 year na siyang kumakalat. At it has been a very successful variant of concern, if I may say, kasi siya yung kumalat ng napakabilis at siya din ang nagkakaroon ng napakaraming iba't ibang subvariants. So gusto ko lamang ipakita, no, yung differences, no, or kung bakit ba natin binibigyan ng halaga itong mga variants of concern. So nang una na is meron siyang capacity, no, to spread very quickly. Pangalawa, dahil maaring hindi pa natin nararamdaman ng simptomas, nakakahawa na siya, mas humahaba ang window of contagiousness. At pangatlo, pwedeng mas naging successful siya sa pagkalat kasi sinasabing maaring may increased environmental stability. So, etong isa pang malaking improvement, no, nitong variants na ito ay yung increased binding to the host receptor. Kaya sinasabi na mas mabilis siyang kumalat at mas mabilis siyang makapanghawa. So, alam naman natin na napakalaking tulong ang naibigay ng mga bakuna. Pero kung titignan natin itong diagram na to, siguro wag na muna natin busisiin yung detalye. Ang punto lang naman nito is kung nagbigay tayo ng bakuna, inaasahan nating maganda ang bisa, over time babagsak ang immunity. No? So this is something that we have established now based on our understanding of the science. Kaya kailangan magbigay pa ng mga booster doses para maitaas ulit ang level ng immunity ng ating katawan. So, dun sa mga nagsabi kanina na hindi kasi nila gaano pang naiintindihan kung ano ba ang role ng booster, kung kailangan nga ba o hindi. Actually, makikita natin dito na ang response ng ating katawan, no, sa ating first and second doses ay napakaigi sa simula, pero over time, bumababa siya at kailangan pang tulungan ng subsequent doses. Pero siguro kailangan din natin maintindihan, ano ba yung minomonitor nating endpoint? Bisa ba laban saan? no? Kasi hindi pare-pareho yung tinitignan nating endpoint or sinasabing effect na gusto nating makuha galing sa bakuna, no? Alam natin na ang mga bakuna when they were started were intended primarily to protect us against severe disease and death, no? So kaya tayo nagpapabakuna kasi ayaw nating magkaroon ng malubhang sakit at syempre, no, ayaw nating magkaroon ng risk na tayo ay mamatay galing sa COVID. And these first generation vaccines were very, very successful against those endpoints. Pero habang lumalao, nakikita natin na meron palang konting pagbagsak ng bisa. Kaya sinabi na kailangan na tayong mag-booster at for some populations, kailangan pang magkaroon ng ikalawang booster o yung 4th dose na tinatawag. So, ano bang klaseng mga figures itong pinag-uusapan natin? Karaniwan, no, over time, when you observe these decreases, there's about a 20% drop, no, each time. Time lapses between the primary series, the initial booster, and the subsequent boosters. So, para sa mga taong maayos naman ang pangangatuan, sila ay nasa young adult age group, maaring wala tong masyadong problema. Pero kung tayo ay may sakit na, no, yung tinatawag nating immunocompromised, o kaya meron tayong iba pang mga sakit, o kaya tayo ay nasa senior population, yung pagbagsak na yan na 20%, napakalaking bagay. At nakikita talaga natin yan, no, globally, na yung mga pasyenteng tumagal na from their previous doses at meron nitong mga risk factors na ito ay bumabalik, no, yung kanilang risk for severe disease and death. Kaya natin ine-encourage ang boosters, either first or second booster, depending on the population that we're dealing with. So babalikan ko rin ulit yung usapin nung variants, no? Maipapakita ko lang muna ito ulit. Hindi ko na naisama yung slide na medyo nakakagulat, pero may imagine natin yung nung nagsimula ang kwento ng COVID, yung tinatawag nating wild type virus ay ibang-iba na sa ating kumakalat na Omicron virus ngayon. Tatandaan din natin na yung mga ginamit nating components ng mga bakunang ginagamit natin ngayon ay nakabase dun sa mga wild type virus o yung ancestral form ng ating COVID virus. So natural na dahil nagbago na ang anyo ng mga virus na ito, yung bisa niya ay maapektuhan. So dito na natin to nakikita. The boosters are more effective when they resemble the circulating variants, at kung yung mga bakunang ginagamit natin ay nag-iiba na dun sa circulating variant, syempre maaasahan natin na medyo bababa ang bisa. So dito na pumapasok yung usapin ng immune escape na sinasabi, no? Dahil hindi na 100% resembling the ancestral virus itong kumakalat ngayon, may bisa pa naman, nakakatulong pa naman dun sa tinatawag na endpoints ng severe disease and death, pero kung sasabihin natin nandun pa ba siya dun sa dati nating inaasahang numero, medyo bumababa na siya. At isama pa natin yung natural na decrease over time, and putting that together makes an important impact, particularly on the vulnerable population. So ito ngayon yung binabanggit ni Dr. NIKKA na kaya nandoon pa rin yung ating emphasis on boosters. Kahit nakita natin na bumaba na yung dami ng kaso sa Pilipinas, kung hahayaan naman natin na yung mga may kahinaan sa katawan ay hindi natin mabigyan ng proteksyon na nandyan naman, madali lang naman abutin, kawawa naman sila kasi nandiyan lang din naman yung mga bakuna. So the question now is, kailangan ba natin ng bivalent boosters, no? So sa ngayon, nakikita naman ng scientific data na definitely, no, may advantage kung gumamit tayo ng bivalent kasi doon na lamang sa usapin ng magkatulad ba siya doon sa circulating variants? Yes, of course, no? Kasi mas bago na itong ipinasok natin sa mga bakunang ito. Ang tanong na lamang natin is gaano ba karami yung ating advantage kung bivalent ang piliin natin versus yung currently available monovalent boosters. Yung mga ganyang klaseng tanong is very dependent on the health on the resources of the health system. Siyempre, kung wala tayong limit sa ating resources at madali nating makukuha sana itong mga bivalent, bakit naman hindi? Pero ibig ba sabihin na walang bisa yung mga monovalent? I beg to disagree, no? Meron siyang bisa. And mas nakakalungkot na napakarami namang monovalent vaccine, hindi natin inaabot at nag-aabang pa tayo ng bivalent. Pero pareho naman silang nakakatulong dun sa ating gustong iwasan, which is severe disease and death. So I think, no, what I'd like to emphasize is, sige, maganda na interesado tayong makatanggap ng bivalent, pero kung yun ang inaantay nating, yun ang ginagamit nating dahilan na hindi mo na ako magpapa-booster kasi wala pa yung bivalent eh. Sa tingin ko, mas mahalaga, no, na makatanggap na ng booster ngayon para maging protektado. Total, hindi naman bawal maturukan ng bivalent kung dumating na siya. So, you can access protection now by receiving a monovalent booster. When the bivalent boosters come along, then you may still access this, particularly if you are in the risk groups. So I think it's trying to utilize whatever is readily available to achieve the best protection possible. So I'd like to end there and once again thank the TBUP team for the opportunity to engage once again with you and to talk about COVID and vaccines and hopefully have the opportunity to participate in the discussion later. Maraming salamat po.
Okay, thank you very much, Dr. Ana Ong Lim. My goodness. So clear, no? Very, very clear yung explanation niya. And I think it complemented the presentation of Dr. Nikka. And I think, wow, I think there are a lot of questions coming up. And so thank you also, Ana, that you'll be able to stay and that you were able to join us on such short notice. Maraming salamat. Okay. Now, our next speaker, I've known for the longest time. So this is a little personal, but siguro hindi nyo alam na for way back in the day, she used to be working on the generics, the rational drug policy, on generics. And then later on, she was working on health insurance, actually health systems and health insurance. So kilala nyo siya bilang mayor. Dating mayor, dito makbulit dating mayor ng Tolosa, Leyte. And we are looking forward to see what her next steps are going to be. But she comes with a wealth of experience in terms of thinking about how do we address these issues on boosters. So I'm very happy to introduce, parang kapatid ko na to, si Dr. OFEL-ALCANTARA. OFEL, welcome.
Welcome. Hello. Susie, damo
Oy.
salamat. Yes. Thank you for this opportunity again. I salute this very matagal ng series ng webinar. Maraming kaninang umaga. Sabi ko, teka, speaker ako mamaya. Ayan, inaantay namin yan, Doc. So sabi ko, marami palang nakikinig. Because ito ngayon, very important ito, natuloy-tuloy pa rin. And especially that you transform, not just on the COVID itself, but all other emerging virus and other very important illnesses that may actually dapat na emerging sa ma-mitigate natin at na early ma-respond natin. So thank you, nandito na naman ako. Siyempre, love na love ko itong series of webinar, lalo na ito ngayon kasi I'm worried. Totoo, bumagsak na ang sa booster. Dito sa Tolosa at saka sa Leyte, malaki yung binaba. Mataas yung primary coverage, but pagdating na sa booster, very challenging din siya. Then I would siguro I will respond in terms of okay. Ano ko muna yung okay.
Go ahead.
I will share my slide.
Sige.
Okay. Share. Bakit na-share ko iba? Okay. Teka, ulitin ko. Nawala siya eh.
Go
Okay.
ahead. Don't worry.
I
Take your
will-
time. It's fine.
Yeah. Siyempre,
Take time.
excited ako dito eh.
Oh, excited din kami. Nandito ka.
Okay, so binabati ko ang lahat. Nandyan, may
Yan.
mga...
Adlib. Yan.
Yan!
Go.
Okay, good.
Yan.
Andyan,
Very
may
good.
mga classmates ako, may mga kasamahan ko dati sa local government na nandyan, may mga kasama ko galing sa RMC na nandyan. And ato pagpakita lang, at even international, na everybody is so concerned nitong virus na ito. So, ito nga, kailangan pa ba ito? Siguro, binigay na yung mga standards nila Doc NIKKA. Of course, dinigay na rin yung ating first reaction on kailangan nga ba ito, no? Of course, Doc Ana. And then, of course, ngayon naman, paano natin ma-operate para ma-increase itong coverage ng ating vaccination ng COVID? Okay. I will start ng very important given yan. Si local government, whether you like it or else, siya ang in charge. Pagdating na healthy ang kanyang constituents, meaning to say, kailangan niya mapabakunahan lahat, especially yung priority group. Pero of course, the LGU cannot do it. Priority niya, pero marami din sa mga local government, paano namin gagawin? Ano ang GIA? That's why the DOH Technical Authority is very important. And of course, dito, itong dalawang very important organization with like Dr. NIKKA, ito yung overall program. That's the challenge now is how to translate that program na ma-localize dito sa communities, sa municipalities, at saka sa mga provinces. With that note, itong naisip ko mabigay na slide because right now, meron tayong universal healthcare kasi nung mayor ako, hindi stand-alone ang ginawa ko for COVID response. In-integrate ko siya with Tolosa stakeholders ang aming LGU na ipasok siya sa health. At ano yung context ng health? Ito ang universal healthcare. And then ito ngayon, I'm the former mayor of Tolosa, but ako rin ngayon yung 1 peso consultant nila because there are still lot of irreversible para maging healthiest ang Tolosa. Context to paano i-localize yung universal healthcare. And mas more so, para ipasok ang agenda ng presidente, which itong 4, maging healthy, maging enabled to be healthy, i-protect, lalo na sa risk. And this COVID pandemic is a risk and financial risk. Then ano bang dapat ibigay dito sa primary care provider network, sa healthcare provider network, at saka yung kabuuan ng probinsya, contribution ng Tolosa to interlocal health zone to probinsya, at na mga services. At ang base niyan is paano ang leadership and governance ng local government with DOH technical assistance. So ito yung 4. In that context, ang vaccination plus. So it's an integrated and holistic. Parang it's a complementation na okay, priority mabakunahan lahat, but we can use an vaccination an opportunity na madala lahat ng programa sa health. At ang dulo, local economic development dito sa mga munisipyo. So vaccination plus, integrate siya sa wellness. And ano yung family health outcomes? Kung may infectious dyan, kung mayroong high blood dyan, at saka may environment occupational health. We categorize to 4. I've been for information then, we've been also coordinating with the group of Doc NIKKA and USEC BEBS. Kasi para din mas ma-feel anong dapat mangyari sa baba at paano ang national policy mangyari na polisiya sa national para sa lahat. And this is really very good, important policy na yun ang sinasabi ni Doc NIKKA, it's a holistic and integrated. But vaccination is one of the many services sa individual services ng ating universal healthcare defined sa technical services. But we can use vaccination as anchor. Parang ginawa natin noon, Susie, during kay late Secretary Plavier, na National Immunization Date, in-anchor ang vaccination ng other public health programs. Yun yung first. Yung second, ano yung GIA? for context ng localization. Ito na yung sinasabi kong universal healthcare, napaka-importante at napakaganda yung pag-layout niya in terms of ano yung services, that's technical integration, ano yung mga facilities at HR na magbibigay ng vaccination, that's the managerial integration too, and then the last, yung bayad na siya. But this is a very important context, and ngayon with this health strategy na 4 na focus, ito mako-context natin yung vaccination program dito sa locality. Ang tanong, Doc Nika, paano matutulungan yung local government para ma-operationalize ito? One opportunity, we have the DMOs na nakababad sa amin sa munisipyo. But paano niya gagawin in terms of total market approach? Anong first step ko, like local market analysis? Anong opportunities mayroon para mapataas yung vaccination coverage at mamitas tayo ng outcome? Yun yung second. Yung third, increasing coverage, sabi nga ni Doc Nika, saka ni Doc Anna, ang coverage mag-i-improve ng health outcomes. Sabi ko, whether you like it or else, mangyayari yan kasi kailangan gawin. At in terms of effective na siya, na intervention, okay, but efficient pa siyang proseso para ang mga tao maging healthy. And that's now yung how the vaccination can increase the coverage. Pang-apat, siyempre, si local government, maraming private sector within the local locality and outside the locality within the province or probably in the region. Kasi ito ginawa din namin during the height of COVID. Paano yung PPP? Bastonado ng government authority o stewardship. Binaston yan ng local government both sa munisipyo, sa city at saka sa province. Yung rich experience natin during the height, paano ginawa? I really salute. Hindi dahil lang mayor ako, but the local government talagang sila ang unang nag-address kasi nandoon nga lahat ang tao at ang effect nasa local government, nasa mga mayors at governor. At these are very rich experience which DOH na makonsider, no? So siguro one of the mga titingnan din ng DOH, Doc Nika, is ano itong mga experiences very rich and challenging ng local government para itong ating ma-maximize natin yung vaccination coverage. So 95% if not 100%. That's really now localization, the whole of government approach for healthiest community. And maging itong problema kaya maliit ang income namin ngayon ng mga munisipyo at mga local government sa IRA kasi ang kanyang calculation ng IRA was based in 2019. Bumagsak talaga ekonomiya ng yung income, ang IRA is dependent on the income, so malaking implication yan sa local economic development. So this vaccination is the number one important intervention para ma-prevent or magkaroon ng herd immunity at lahat ng tao protected na, aside na palakasin pa lalo na yung mga compromised na mga pasyente. And then the fourth, there are private sector na nangyari naman, but I think nga buuhin ito, especially sa community. They are our additionality, our complementation and contributors to outcomes, especially barangay health workers federation sa community, academic, kaya ko dito yung BSU, kasi sila din ang tumulong sa amin sa vaccination. Naging capacity building arm namin sila at saka research arm during the time of COVID, and of course the CSO. At fifth, ito sabi ko masalamat naman at tuloy-tuloy at in-expand pa at nireforma ang Stop COVID Death na UPT TV webinar series. This is very important to all of us, especially sa local government, to context para mabuo, hindi mahirapan, effective saka efficient ang gagawing intervention. This continuous learning and eventually the shared visioning ang within munisipyo to interlocal health zone to province-wide. Kasi with that, ito yung gusto natin, healthiest, which yung sabi, primary healthcare. Sana itong 90% nasa community ang management, including this 95% coverage for immunization, COVID and the other EPI. And that's a very good move, Doc Nika, that the COVID-19 vaccination will now be part of the expanded program of immunization. And that is a very important trust. And then ang kailangan namin is a policy that will support kung paano din namin ilo-localize. And then second, yung healthiest, especially itong structure. Anong structure ang gagawin ng local government from the local health board? And so yung people within the organization, ano yung policy especially with this bivalent vaccine, monovalent man siya at bivalent, available ang isa o dalawa, kailangan ba tuloy ang bakuna? That's a very good important health message. And then the systems that we'd like in place, discuss ko yan a little bit, especially ang aming ginamit kasi, consulta package as anchor. And then, of course, kailangan yung financial para backbone, para ma-facilitate itong pag-implement ng ating vaccination program. So ito yung para sa akin, very important for local government to look into based on my experience as mayor and now as a consultant of the Department of Health and also with PhilHealth and some other professional groups. This slide, wag kayong matakot, is just in-integrate ko yung universal healthcare para lang mas maintindihan at saka yung health goals ni President ngayon, na 4 na goals. But ang importante dito that I would like to show is those to enable to be healthy, the social determinants, because the reason mostly is about determinants of health and health literacy. And that's equals health promotion. That's part of the technical integration. Pagdating naman, especially yung care for wellness, sa primary care, crucial yung BHW. But again, ano yung message na i-develop natin for BHW para kasi siya ang nandoon sa and right now, Susie, WHO is helping us with social determinants in 2 countries. Sa Philippines, Tolosa ang napiling site. And it's really, ngayon marami na kaming learning sa social determinants. So with CHD8, makakatulong din ito sa vaccination na ginagawa natin. Para ano ba yung behavior, bakit ayaw magpabakuna? Alam naman natin, napaka-importante yan para sa individual, sa komunidad at saka sa local government na siya ang stewards natin. And of course, the last, itong protect, especially yung financial integration na ito. But I would like to, doon sa baba, the governance part, is strengthening the institution that will implement the vaccination program using UHC and health strategy as context. So that's now DOH, LGU with DOH. But sa LGU is to make it total market approach doon sa local government. Yun ang pero importanteng message dito sa context na ito. And then, ito yung reason, kinategorize ko into 3. 1, the people themselves. Nabi ko nga, napaka-focus sa social determinants. That's equals health promotion. But I think we need to strategize to be effective and efficient in delivering the services to the family, to the supporters of the family, and to the local government who's governed to make sure that the coverage and became so high, 95%, and then also maging healthiest ang kanyang community at saka yung kanyang people. Nag-study nila sila, Doc Nika, again, Doc Nika, baka with the CHD and the DMOs, ano ba ang meron sa local government? Challenges and opportunities, especially on social determinants, para ma-improve yung health-seeking behavior. Yun yung first. Kasi kung hindi yan ma-address, kahit ilagay natin kahit na bivalent na sinasabi nilang mas siya kaysa monovalent, which is not the message, pareha sila pwede. Okay, so dyan kailangan i-address yung behavior. The second is yung LGU stewardship. Dependent dyan, there are yung experiences nga during the height of the pandemic, paano yung strong local governance na ma-facilitate na ma-reach itong ating mga constituents at magpabakuna regardless kung monovalent siya at saka booster. Kasi right now, na parang lahat, I think may implication ito ng economic din. pagsabayin. Kasi parang okay, umopen na ang market, nandun na ekonomiya, but ngayon even the mask, hindi ko na masyado nakikita. Na in some areas, lalo na sa mga close, na very crucial at important pa rin ang mask at saka hand washing. These are very important messages that the LGU can parang bastonin niya, John Shepherd. Kasi like itong Tolosa, yung vision, nag-shift na siya to being the role model of good governance, to be healthiest Tolosa with strong local governance. Sila talaga yon. Kaya kailangan lang ng giya. But the third, mga opportunities and challenges that it gears with public and private participation, partnership for better health outcomes, making them health development agents, especially for those that are not health. Dito naman si CHD, si Director EXO, sabi niya sa Region 8, number 4 is strategic objective ko yan, na lahat ng hindi health, maging health development agents. And I think these are very important 3 considerations to look into further the challenges at saka opportunities in these 3 areas. Of course, with DOH technical authority or assistance. So with that, I would say, with universal healthcare and strategy, LG on DOH for better health, ma-improve. Ito yung DOH, so mayroon ng, paano ito gagawin, Doc Nika, na policy? Kasi standard na yan, pinag-usapan na with the infectious group. Ano yung standards, policy, at paano natin magiging health promotion at ika-capacitate not just the DOH, but also the local government, especially midwives and RH staff and BHW. And ito yung gusto ko ipaabot, yung second. Ang consulta package is a very good opportunity because lahat ng constituents, like dito, 23,000 every year, i-consult siya. So malalaman mo kung sino yung life stage sa pamilya, sa pa-household na yan, nasaan siyang setting, sa school ba siya o nasa workplace, may risk siya, earlier risk, kasi may siya, yung anong tawag dyan, yung mga comorbidity. So paano with that, yung leadership para, yun nga, PPP ang ating approach, meron mga opportunities and challenges right now para mabigay natin to. And then last, the increasing vaccine coverage to this universal health, integrated services, community involved, systems, health financing, and paano yung performance tracking. I would like to deal a little bit. Paano ito na yung aking parang call for action. Integrated services. Integrate this. Kasi meron ng mga policy omnibus guidelines. Paano natin to implement dito sa mga household, sa barangay, o sa primary healthcare network. Pangalawa, sa community, nandoon yung social determinants na very important. Paano mas ang solution, reach, ang experiences pagagawin. And then yung third, yung first napaka-importante. Ano yung executive order? Kasi dito nung ako, every month, naglalagay ako ng executive order that time. Pero ngayon hindi naman siguro kailangan every month. But the executive order, galing yan sa central. Ano yung guidelines at saka ordinance kung kailangan sa SB. Data. Importante ito to have an effective and efficient strategy. May pilot kami ngayon with USA. Nakakatulong ito para ma-analyze. And then yung capacity building, especially sa primary care provider network, health promotion. Ano yung message? Paano natin idadali ng message? And then 6, financial management. Doc Nika, we need also to consider, especially na LGU na ang bibili, we'll be assured that the vaccine bibilhin, but the support to vaccination, malaking yan, kasi ang IRA talaga ngayon is reduced because based on the 2019 budget. And then, paano i-manage yung fund, and of course, yung stewardship nga ni Mayor at saka ni Governor, at saka Chief Executive. And last, yung financing nga, using consult as anchor, at yung tracking, ilan na, ito na yung dapat mabakunahan. Baka din turuan ng paano mag-population, demography, at saka target setting. Ito ang number 1 by area. Okay? So with that, ito yung sinasabi kong services. I will not deal with this. Pero ito yung kukonsider natin, diniscuss ko na rin ito kay na Doc Nika, para holistic at ano yung package guidelines with vaccination plus individual services. And with that, I would say that call for action na 5 is, of course, DOA, the LGU, together with DOH for technical assistance, and of course, to serve our Filipinos with these continuing webinars. Patuloy ito lagi ako, halika na, patuloy na universal healthcare. Ang ngayon ang focus ay universal vaccination coverage for universal healthcare. Damo nga salamat. Thank you very much.
Uy, thank you so much, Ophel. Uy, palakpakan naman natin. My goodness. I'm blown away by the presentation of Dr. Ophel, how she's able to actually, it's complementary to NIKKA, complementary to Anna, and how she actually framed this as a problem of the whole health system. And talagang universal healthcare yung pitch niya, no? So I think from describing the problem and explaining it in depth and down looking at possible solutions, we're really grateful, Ophel, that you gave us some time also kasi we know you're very, very busy. So maraming salamat sa presentation. And again, you'll see the appreciation of our audience for the presentation. Okay. So Raymond, over to you.
Thank you so much, Dr. Ana and Mayor Dr. Ophel po, no, for excellent reactions. We don't have a lot of time, but I wanted to make sure that everyone has the opportunity to type in their questions already in the Q&A po, no? And we'll ask our panelists.
Maraming questions, Raymond. There are a lot of questions. Did you see? Maraming mga questions. So,
in
yeah,
the chat,
anyway.
but not in the Q&A kasi, okay. Pero some of them are,
It's in the Q&A
okay.
box. Oo, sige.
Okay, so but before we start with the questions and the Q&A po, no, we'll take a very quick break for a special public service announcement today.
Ay, ate, gusto ko nang lumabas at makipaglaro.
Eh di ba magkakasakit daw tayo kapag lumabas?
Magpe-face mask naman ako eh.
Kahit na, hanggat wala daw tayong injection, hindi tayo pwedeng lumabas at maglaro.
Ano ba yan? Takot pa naman ako sa injection.
Huwag ka mag-alala. Parang kagat lang daw ng langgam yun.
Talaga? Eh natatakot pa rin ako.
Eh di sabay na lang tayo.
Pa-injection?
Oo, syempre. Loves kita eh. Para makapaglaro na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP, the COVID communications public service announcement po. No? Really, it's one of the many outputs, creative outputs that we have from the Stop COVID Deaths team to push for pediatric vaccination for children 5 and above. Please share this video clip with all of your social media networks. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay, Dr. Susie, let's get the ball rolling with the questions.
Let's get the ball rolling. I mean, I have a kind of like just an opening question, and then let's go into the many different questions from our audience. But this is for everyone to give a quick reply, no? I'll touch on, I would say, like a little bit of a, what should I say, a little bit of a sensitive situation, but I think it's worth discussing, no? So, I think in general, our message is booster, whether it's bivalent or monovalent, right? And at the same time, we know that there were vaccines that we were not able to use. We had too many vaccines, and I think Anna alluded to this. So the question is this, right? I know that we want to protect the most vulnerable against severe disease and death, but haven't we learned from our previous primary rounds, right, with the vaccination, that really, if you target the family as a whole instead of just the seniors or just the health workers, you'll get a bigger, what Ophel calls the outcome. No, kasi we're really very we're family-oriented eh. Actually, makukuha mo yung mga seniors kasi lahat nagpapabakuna. No, so I just want to ask that question a little bit because I got triggered by that because Ophel was talking about the life course. She was saying, okay, from children to adults to the seniors and so on. What's your thinking on this? On more of a kind of like household or family approach to vaccination, instead of singling out again the seniors, and before doing anything else, ubusin muna natin yung mga seniors, no? So just quick responses from everyone, and then we'll go into the individual questions. Sige, let's start maybe with Anna.
Dr. Susie, I think this just recognizes really the increased risk of certain age groups and health conditions for severe outcomes. So gustuhin man siguro natin na lahat ng eligible population ay mabigyan ng bakuna, we have to recognize that within the limitations of our resources, syempre we prioritize according to those who are going to require the vaccine the most. Kaya siguro ganito yung approach, not just in the Philippines but also globally, particularly coming from WHO as guidance. So I think that's a very difficult message to communicate. Kaya din siguro yung narinig natin yung ating interviews of the people on the street, litong-lito sila, qualified ba ako magpabakuna? Kailangan ko na pa pala. No, so that's actually a very challenging scenario, and I think it's really something that the public health authorities need to focus on, no? Transmitting that information that yes, there are boosters, and yes, there are people who need the boosters. So if you're one of them, please be boosted. And that's a message I think that isn't very clear to many of the people on the street.
Yeah, I think you did talk really about people don't understand why they need the booster. Number one, right? Yun yung ano. And then we go to the question of we need to boost first the seniors and the elderly, which I don't disagree with. I'm just saying that having had seniors and elderly people in our families, like in my family, I know that they'll go if we all go, something like that. So anyway, let's go to NIKKA. NIKKA, I'm being a little provocative. Sige, go ahead.
Yeah. Actually, Doc Susie, I think yun naman talaga yung intent, no? And as I alluded to the long-term plan na this is included already as among parang routine immunizations necessary for anyone. And that assumes when a family goes to their provider, hindi lang naman usually, di ba, yung tao yung tinitignan doon. It's usually also giving advice, especially if we have the primary care providers of the future. They're also providing all of the necessary advice to all the other members of the family, joining them in their consult. So that's a longer term opportunity for all of the vaccination, not just the COVID vaccination, to be a priority intervention for everyone at any point of care, no? Siguro yung specific lang dito sa pag-roll out ng COVID-19 vaccination, aside from the prioritization that Doc Anna mentioned, it's also the protocol of having first identified phases for the rollout is also for the parang learning the good practices before you do a whole nationwide rollout, no? So kunyari yung examples natin sa pagsisimula ng boosters, pagsisimula ng adolescent, it's also wise and prudent to first start with a smaller scale. That's what we usually mention as phase 1 interventions. And then very rapidly naman, usually in a matter of weeks, in a matter of months, it's going to be rolled out then in the future. So we're just working out those kinds of logistic issues for the bivalent. Pero as mentioned po, hindi naman kasi siya parang separate vaccination site for bivalent, separate vaccination site for monovalent. What we're going to do is really encourage booster for everyone, and whatever the supply that is going to be available will be done for everyone. So yun, very lang po, but well noted that is really what we've seen as a good practice kasi in terms of intervention. Thank you.
Yeah, thank you very much, NIKKA. I think what we're seeing also in other countries is that they are communicating you need a yearly vaccine. It's like especially for the seniors and the elderly, like flu, because this is not yet a vaccine like the measles vaccine, which is like you get lifelong immunity. Wala pa tayo dun di ba? Ultimately, we should be coming to a vaccine that's like that, or it's going to be like the flu vaccine, which will be recurrent every year, iba, no? So anyway, Ophel, what do you think about the seniors?
Yeah, I'll do 3 at sasagutin siya ng medyo global. 1, ang approach ko kasi parang ang target client list natin ay family. Because if we singled out ang senior, mawawala ka. So look at every family. Ito ang services para dyan. Okay? Kasi may humahawak na BHW yan na 20 household. So that's 20 household, then 5,000 population hinahawakan ng midwives. So kayang-kaya maabot. Ang point ko is, mas maganda na family ang approach at saka hindi sa program target client list na ginagawa pa natin noon sa FHSIS na programa ng TB, programa ng API, isang target. Buong pamilya tingnan. Para ang buong pamilya, ito ang para sa'yo. Para maging healthy ka, ito yung para sa'yo. Pangalawa, very maganda yung approach because ito nga ang initial study namin with World Health Organization. We always consider the families as clients. Yung second ay, clients natin silang sisilbihan, but let them be part of the solution. And then that's a very important message. How can they be part of the solution? Especially that this vaccination ay para sa kanila, primarily. Of course, there are priorities based on kasi magpapaganda ng health system at of course with some resources limitation. So ito yung second. Yung third, is the integration ng family, especially like comorbidity. Anuhin ko na lang yung elderly kasi sinasabi natin. Ang mga senior, naghahanap ng flu vaccine every year. Kasi gusto nila ma-flu vaccine. Bakit pagdating ng COVID, hindi mag-100%? This is a very good anchor na using the flu vaccine as a mechanism para sabihin ng may flu ka na, o yung hindi na pneumonia vaccine na ngayon mo na, 5th year mo na ngayon, at saka isama ito. Ibig sabihin, a life stage approach by family. Napakaganda probably. But again, the local government will need guidance and also resources to support para ma-localize. Buhusan ng support papunta sa pamilya. Thank you.
Thank you very much, Ophel. It's a little provocative, but I think it's great to hear your views on this. Okay, so let's go, Raymond. Let's pick up already on a couple of questions. Then we'll have to close. We're coming close to the top of the hour. Go.
The question here, Dr. Susie, but it's more of prioritization. So will senior citizens be prioritized in receiving the bivalent vaccination? How about for like general population po? That's for DOH.
Yeah. So currently, the guidelines are being finalized. But as I mentioned, yung first phase will start with healthcare workers and senior citizens. That's mostly also a consideration of supply. Pero as I mentioned, ano naman yan? That's mostly really for the initial rollout. Succeedingly naman talaga, it will be open for everyone. I just can't be able to provide timelines right now. But as repeatedly mentioned, we have a lot of other vaccines now. So we shouldn't be waiting for the bivalent to be getting our boosters, especially if we haven't had that yet.
Right. So I think the main message, right, is that people should get boosted. Don't ask anymore what your booster is. Just get boosted. Kasi 20% lang eh. Hindi ba parang ganun yun, Ana?
Comparing the vaccine efficacy against hospitalization, there's a drop of about 20% between doses, between the primary and the first booster and the second booster. So baba siya ng baba. Kaya lalo na siguro kung we are not at the peak of health, that 20% is going to make a big difference, right?
Right. So we really have to push for the boosters, no? Raymond, parang wag nyo nang, I think all three speakers have said, wag nyo nang antayin yung bivalent na yan. Magpa-boost na kayo, no? Okay, go ahead, Raymond. Some more questions. I see some in the Q&A.
Most of them have already been answered, Dr. Susie, by Dr. Ana. But this one, let's get this one. Since flu vaccines have been mentioned, studies conducted on the production of a flu-COVID combined vaccine. Any timeline po on that one?
Ana siguro yan. I don't know if they have that.
Yeah. So also picking up from what Dr. Ophel has mentioned, 'di ba, yung programang flu vaccination is really very well established. So it really does make sense to have these combined vaccines for respiratory tract infections that are transmitted the same way and target the same vulnerable population. So that is part of the development program of vaccine researchers. But I can imagine the challenge, no? Kasi unang-una, nandun pa lang tayo doon sa pan-SARS-CoV-virus vaccination. What does that mean? Ayaw na nating magkaroon pa ng mga variant-based vaccines. Gusto natin sana isa na lang at one and done tayo. So yun muna siguro yung direction po ng development. And then eventually, once they're able to establish that, then baka magkaroon tayo ng mga multivalent vaccines na kasama na sana pati yung flu. But that is a very good idea and it's something that's being explored.
Okay, thank you. Thank you so much, Anna. Raymond, we're out of time and
Yep.
we apologize to our audience. I know you have a lot of questions, but let's go to our fun quiz and let's answer this.
Can we also have the Slido on the screen? That was okay. Sige po, thank you so much. For the first question, receiving the primary series refers to receiving what? Dr. Nika?
Yeah, so primary series, for now, what we mean is really the first 2 doses that you got. So for most of us, it's 2 doses. For a select portion of us who got the Janssen, that's 1 dose. But it's generally meant to mean the 2 doses. Thank you.
Okay. And then for our second question po, the appropriate time interval for receiving the booster. Dr. Nika.
So the appropriate time interval is actually tama yung first, 6 months, but it can be as early as 4 months in what is allowed. But generally, we recommend at least 4 to 6 months from your primary series, you get your first dose, and again, another 4 to 6 months for your second booster dose. Thank you.
Okay, thank you so much, Director Nika. We'll take this time out for our panelists to come up with their final messages to the audience. But in the meantime, what we are showing on the screen is the panel discussion poll. It's 5 questions, 4-point Likert scale, and hope everyone will be able to participate po, no? I'll read through the questions. The panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, number 5, the panelists contributed to new perspectives and knowledge on managing various key health issues. We'd like to take this opportunity to also thank our panelists for a very rich discussion. Not every day that we'll have this mixture po of panelists. So thank you so much on behalf of everyone here and our online community. We will not be closing this panel discussion poll, our evaluation poll, as we move on to the final messages from our speakers. Dr. Susie?
Yeah, thank you so much, Raymond. And again, thank you to all our speakers. And I saw a comment here in the chat na we should continue talking about this because there's so many permutations of how people got vaccines. So we'll think about, thank you so much for suggesting that. We'll think about talking about this again. And we'd really like to support the government campaign for increasing the booster coverage for the high priority groups and later on for the entire population. So we will start with our short messages for the rest of the audience. We'll start with Dr. OFEL-ALCANTARA. Ophel, parting words.
Okay.
Unmute
One,
or unmute. Yan, okay.
don't forget the local government stewardship. Second, DOH to support that stewardship para mangyari. Third, to focus on the family. Para masama na yung lahat at really engaging them to be part of the solution para ma-increase ang coverage at eventually a healthiest family. Thank you.
Thank you so much. That's Dr. OFEL-ALCANTARA, who is consultant to the DOH and to the Municipality of Tolosa, health expert. Thank you so much. Let's go to Dr. Anna Ong Lim. Anna, take it away.
Yan. Thank you po, Dr. Susie. At maraming salamat muli sa pagkakataon na magkaroon ng opportunity to engage with our audience. I'd like to use this time to remind everybody about the value of boosters, no? So kung dati ang focus natin is sana magpabakuna tayong lahat para mabawasan yung risk ng severe disease and hospitalization. Panawagan naman ngayon is sana mapanatili natin yung protection na ito by benefiting from the impact of boosters. Whether these are monovalent or bivalent products are beside the point sa ngayon, no? Kasi meron naman tayong monovalent and they're readily available. So yung mga qualified na makatanggap ng boosters, which are our 12 years old and above, no? Dapat naka-first booster na tayo lahat at yung mga 50 and above dapat nakadalawang booster na. So kung nabibilang po tayo doon sa mga grupong yon, magmadali at magpabakuna. Maraming salamat.
Thank you very much, Anna. Very clear, Dr. Anna Anglim. Okay, so Dr. Nikka Howe from the Department of Health, go ahead.
Thank you po. Siguro first and foremost, on behalf of the Department of Health, I really want to thank our UP community, no? Kasi we've really been having UP as our partner in everything that we're doing for disease prevention and control, and also, of course, for COVID. And it's opportunities like this that we are able to share a lot of the things, our plans, and also clarify some misconceptions. So hopefully we continue this kind of partnership moving forward. Second, I guess i-reiterate ko lang no na talagang we want to keep opening our economy and we want to ensure that we are all protected when we do that. And boosters will bring us there. So we're calling on everyone to talagang whole of country, whole of society approach. As we have successfully shown in the past weeks, in the past years na if yung mga bright ideas natin, like a lot of the things raised earlier about the community approach, etc., these are implemented on the ground with the LGUs, we really need everyone to put their hands on the deck para magawa natin ng solusyon itong masyadong mababa na booster coverage natin for the country. And I guess last is, I know a lot of our people listening here right now are healthcare workers, no? As shown in the survey, malaki ang trust na binibigay to healthcare workers and to experts. And we also hope to have you as our allies in amplifying all of these messages because people trust you and people follow you as well as us, no? So talagang we really need your help to battle all of the things that we have to do for the country. So maraming salamat po for giving DOH a chance to be here. Thank you po.
Thank you very much. It's Dr. Nikka Howe, who is a director at the Department of Health, and thank you for being with us today. So Raymond, we want to give the feedback on the evaluation before we go to the closing.
Okay. So it's still ongoing. Okay. It's shared the screen. So at least 94% po of all of the attendees really have well received, or they strongly agree with all of the statements, and really is a testament po for each and every one of the panelists and the knowledge that they've gathered from this webinar for today. Dr. Susie?
Okay, thank you very much. For closing remarks and synthesis, we have none other than the head of the, I call it EETO, so I'll remember Raymond, no? Expanded Education and Training Office of the Philippine General Hospital, Dr. STELLA Mariligaspi Jose. Stel, go ahead.
Good afternoon, everyone. I'd like to acknowledge and thank Dr. Nikka Howe for a very good update regarding DOH. And DOH maximize the access to vaccination, and they expanded their areas of access. No? So you can get vaccinated in the offices, in the factories, in the hospitals, and in other clinics. However, they noticed that there are gaps in the A1 and A2 category, and that there is a low booster uptake. And the percentage of the A1 who had their first booster was 63%, and for the second booster, a low 29%. What we want to establish, what DOH wants to establish is the wall of immunity. This was mentioned in other webinars of ours, no, that the wall of immunity is very important because if all in the family is immunized, there is a very, very small chance of getting infected with COVID. Dr. Anna Ong Lim emphasized the role of booster doses. And as mentioned, the antibodies start to wane, no, after a while. And so booster doses are necessary because of the waning antibodies. What she emphasized is it's more important to have the booster dose, even if it's a monovalent vaccine, and utilize whatever is available rather than waiting for the bivalent vaccine. And she mentioned that you can get the bivalent vaccine even if you had an earlier monovalent vaccine. Okay, so, and for Dr. OFEL-ALCANTARA from the LGU, it's very enlightening that the role of the LGU is emphasized in this webinar. The individual services, for example, they are integrated and holistic in the LGU level. So that means that when they advocate or advertise vaccination, they also add the wellness program and family health programs of the LGU. So when they do the vaccine, they also treat the patients if they have hypertension or other illnesses, and that makes it like a package deal already. And they also had an increasing in their vaccination coverage, and also they have public and private partnership with the government. And what I like most about her talk was the importance that she gave to stop COVID death. And she said that there is continuous learning with our stop COVID death. Thank you very much. Back to you, Susie.
Hey, thank you very much, Dr. Stella Marie Legazpi Jose, who is with the Philippine General Hospital. All right, so next week, don't miss it, okay? Dr. Ted Herbosa, who's head of the Department of Emergency Medicine at PGH, is organizing a discussion on emergency medicine. And I think you're all very, very interested in that. I think they're celebrating a 25-year anniversary, but he has lined up some speakers to talk about emergency medicine and for you to all be updated on the latest on this. So don't miss it. We'll be talking about emergency medicine next week. Raymond, over to you.
Thank you so much, Dr. Susie, and thank you also to the new head po na expanded pa sa training office po of the Philippine General Hospital, Dr. Stella Marie Jose. Before we conclude our program, we'd like to let you know that all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel for your convenience po. And at the same time, our shorts, our SED shorts po, no? Very, very short and consumable videos. Hopefully, you'll be able to see them and view them while you're commuting or waiting for someone, maybe you're at the dentist, etc. Something for you to be able to just learn and gain knowledge and the nuggets of wisdom from these short YouTube shorts po in our TVUP channel. Okay, so this formally closes our webinar for the week. We look forward to your company again during our next Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.